Oftentimes, when we talk about health, we tend to talk about physical well-being, but an equally important aspect, mental health, is often left out of the conversation. Around the world, 1 in 4 people will be diagnosed with a mental or neurological disorder at some point in their lives. Globally, 450 million people have one of these conditions. Although treatment is readily available, almost 2/3 of people will never seek treatment due to stigma, discrimination, lack of education, or lack of access to treatment. The stigmatization of mental health is particularly an issue in the South Asian community, where mental health often does not get the attention that it needs. In order to get an in-depth look at this issue, we decided to chat with some people from the Indian community to better understand their experiences with mental health. Let's see what they had to say about it.
My name is Deepjyoti Deb. I grew up in Burlington, Massachusetts, and my family is from Calcutta, India.
My name is Aishwarya. I'm originally from Atlanta, and my family is from South India, Tamil Nadu.
Hi, my name is Maitreyi, and I'm from Mumbai, India, born and raised.
My name is Tapan. I was born in India and was there for 7 years. And then I mostly grew up in Atlanta. I've been here for about 17 years now.
Hi, I'm Pooja Patel. I grew up in Goshen, Indiana, and my family is originally from India.
Hi, my name is Shakti Sharma. I grew up in Nottingham, United Kingdom, and my family are from Punjab in northern India.
I'm Lavanya and I'm from New Delhi, India.
Well, the quick answer is no, they did not.
Conversations regarding mental health almost never happen in my household, and I feel like mental health in India is still shrouded in stigma, and it's almost like a taboo to talk about it.
No, they did not. Mainly because there was really no one who was directly suffering from it. It was something that was just left unsaid because it wasn't really affecting anyone, so it didn't really need to be talked about.
I think that my family tended to have more conversations about mental health in our household than maybe some other South Asian American families, just because my parents are in medical fields and so they have some type of exposure to mental health.
Yes, conversations about mental health did happen, but I would say it revolved more around yoga and meditation and how to be healthy mentally, and not really about depression or when it goes wrong, what could happen.
So one of my mom's closest friends suffers from manic depressive disorder, so she was bipolar, and there wasn't a lot of awareness about this condition. So people around us did not understand why she would behave a certain way for about 8 months of the year. For 4 months, she went into depression, and they sort of started distancing themselves around her, which was actually really, really sad to see. And I think that was a point where if awareness would have been there, they would have been there for her. And I think that just made her depression worse because she felt isolated.
So, because we grew up in a household that talked about mental health, I think everyone in my family has essentially been to therapy for some period of time in our lives. Me when I was 16, my brother when he was 14, my sister when she was in college around in her 20s, and my parents in their adulthood lives.
I'm from a neighborhood which has a large population of Indian people, and I think overall the attitude toward getting help with mental health is pretty negative, and people usually tend to discourage their children from getting any mental health, and if a child brings it up because they learn about it in school, parents are usually not inclined to go along with it.
Honestly, from my experience, it's not something that you hear too much about, and I don't think it's something that's spoken about openly. Also, I don't believe a clear place has been identified where you can go and talk about these things with a professional.
So one really important thing which I feel should be done is that in order to destigmatize mental health issues, you have to start training and talking about it very early on. So right from school.
I think what can be done is just have more education in the community, not only in schools, but maybe in churches people go to or the temples they go to, maybe having some kind of community classes.
I think parents can definitely sit down with their kids and be more open and communicate about mental health.
So I think destigmatizing it within South Asian culture and promoting it as something that's about holistic health would be something that would be vital in making sure that it's destigmatized.
I feel that things are changing in mental health. India is drawing a lot of funding for mental health research, and I feel like research is where everything begins.
So as you can see, mental illness impacts us all, whether it affects you directly or it affects one of your loved ones. The first step towards breaking down the stigma that surrounds mental health is acceptance and awareness. So let's all do our part. Let's talk about it.